dragging people like me into it. I think that would have been the problem, but it only took me maybe a day to change my mind. I am not sure how long it took other people, but it certainly, once I saw it and did it, that was all it took.
Well, one of the things that's really good is that we can move so many more people through now than we could before. So we're able to, and with the larger building and moving people through, we're just, able to give so many more families the opportunity to come.
Building volunteers would work together around a table, and they would pack these boxes, and then they would all go on break at the same time, and they would, talk and get to know each other, or maybe they knew each other already. And that was like really nice coming to Echo. And we were afraid we were going to lose one of our whole crews, and we didn't know how we were going to replace them, and we didn't want to replace them because they were great volunteers. But they liked it, and it's a lot less work. And then we were also afraid that clients were not going to like it. And I think there was one client who said, I don't want to go through and pick out my food. But we certainly have not heard any complaints since then.
One of the biggest things is still the people that come in and pick out the things they need or want, and they're not getting things that they will not ever use. And that's saved us a lot. We know everything that's being taken out will be used.
Some of my concerns with going to Client Choice had to do with making sure that everybody involved in the program was on board with the switch. We had a lot of support still from people who helped set up the programs and have been invested in it for a long time. It was a delicate transition because you didn't want anybody to feel like their work previously wasn't important, and that there weren't any negative reasons from their service that we were switching to the new model of service. We have had a lot of volunteers and staff report that it's a happier environment when the clients get to choose what they want, and it takes a lot of pressure off of them from having the responsibility of making sure the clients are getting the food that they want just based on your own guesswork. I think some of the biggest challenges and barriers were figuring out how our food shelf was going to be set up. Our entire back room, which we used to use as stock, has turned into the Client Choice area with the shopping. So it was setting everything up and making sure that it was user-friendly and clients understood we have signs posted for each category of food and how many items a family can choose up to. So it was making sure that the signs were easy to read and people could understand that.
Older people, I'm not here a lot, but they seem to use it because it is like shopping more in a market than, I'm getting a handout from somebody. And from my standpoint, the older community in these smaller towns are really the ones that are suffering because they're not used to taking handouts.
I don't think we really understood what Client Choice was going to be, so we were very open to accepting the changes.
I agree. We just kind of went into it thinking it has to be better than what we were doing. No, we're in a very happy place in our food shelf, and our clients love to come. We're seeing our numbers rise. They come in and they leave with tears in their eyes because they have so much food. Our resources have helped us tremendously with meat, and we have clients who tell us they're just overwhelmed because they can feed their family meat 5 days a week. Getting our volunteers to change, getting our clients to change, and you know how everybody loves to change. And it was a challenge, but we worked through it, and we're so glad we did it. I think they're finding out that the choice model is fun to work in. that it's a community and that you get to know your clients when you're working with them.